Hi guys, this is Dr. Naman. Today let's learn a bit about the topic called stress. There are hundreds of videos related to it. I just want to share some of the basic facts which are related to stress, its management, ways to deal with it, how it happens, and does we really have a cure of it or just cope up with it? So there are so many questions related to it. So I'll start with a basic thing that we have all heard of or seen in any kind of motivational video, that every yogi or every person who does pranayam or every person who does meditation tells us to focus over this area of us, okay, right between the eyebrows. Why do they say it? So let's proceed to this question in a stepwise manner. I'll use some of the medical terms related to the stress and I'll eventually describe what are they, and in the end of this video I'll attach some of the things that I do to cope up with stress, and it has worked very till now it has worked very nicely with me. So let's begin this topic. So basically I'll start it with a very simple aspect, that there are two parts in our brain. One is called amygdala and one is the prefrontal cortex, that's right here, okay, in the frontal region of us. Okay, so basically what are the functions of this part? So question first, what is the reason of the stress, how the stress arises in our body? So first of all, there's a region called an amygdala. This region is situated in the medial temporal lobes of our brain. Temporal lobes are situated just right above our ears. Okay, there are two temporal lobes. So this amygdala part is responsible for the flight, fright and fight hormone release. Okay, so this area controls pain, it controls pleasure, it controls sexual excitement, it controls our emotions, it controls our fear, it controls our anger. Okay, all of these things are controlled by this part called amygdala. So this part of amygdala, this amygdala part, it causes a hormone release in our body called as cortisol. Cortisol hormone gets released from the adrenal glands. Adrenal glands are situated just above our kidneys. Okay, they are triangular shaped glands. From those glands, hormone releases called as cortisol, and this cortisol hormone, it causes stress in our body. Okay, so this prefrontal cortex, or this region of our brain, it has got many functions attached to it. Okay, so we'll discuss one by one what are the functions of it and how many parts does it have. So it has got three parts: dorsolateral part, ventromedial part, and occipitofrontal part. Okay, the first part, that is dorsolateral part, this part deals with planning and execution of those plans. For example, you're making a trip, or you're just for example you're making something in the kitchen, you have got the recipe, so you have to approach step by step. Okay, so this part deals with planning and how to execute them. Second part is the ventromedial part. This part deals with motivation. Okay, a person who has got this part underdeveloped will be always apathic, will be under motivated, and that person would have difficulty in initiating sentences, or would be less expert in communicating with people. Third part is the occipitofrontal part. This occipitofrontal part basically deals with distractions. Okay, there was a person called named Phineas Gage. He had one iron rod blew through his this part, occipitofrontal part, and eventually that person became very restless, became very crude in nature, became very irritable. So he used to get distracted very easily. Okay, so people who do not get distracted easily have got this occipitofrontal part very much developed, because this prefrontal cortex has got a function to save us, to improve our focus, to improve our determination, the thinking, the goal setting ability. Okay, so these were the different parts of the prefrontal cortex and the different functions associated with it. Now I'm going to tell you some moral values or some definitions that are attached to this region, okay, one by one, and how and these things, or these different values have got a very sensible meaning in our profession also. So there are 9 things that are attached to this prefrontal cortex. First one is the empathy. Empathy is the ability to understand something from someone else's perspective. Okay, so if we are not empathetic towards the patients, we'll lack a sense of communicability between the patients and even with the co-workers. Second thing is insight, or we can say conscience. Okay, basically it's a inner sense of knowing things. Okay, that you know that you can do this thing. If you assume that you know this thing and you can do it, you will definitely do it in a more better way as before. Okay. Third thing is response modulation. Response modulation is listen to something, take a pause or stop, and then react to it. Okay. Fourth thing is emotion regulation. Emotion regulation is extremely important. If we lose it, everything becomes chaotic. If we are too much emotionally regulated, things become rigid, and it might lead to unprofessional behavior as well. Fourth one is the body movement. Fifth one is the body movement. Body movement refers to connecting our sympathetic system to our parasympathetic system in a nice manner. They both are parts of autonomic nervous system. Okay, particularly it helps in managing complex tasks, particularly in the field of surgery and almost in every field. Sixth one is the morality. Morality refers to something that we are doing on behalf of a large population. We are thinking, we are behaving in a particular manner. Okay, on behalf of a large population whose basis are good norms. Okay. Seventh one is the intuition. Intuition is the inner sense of knowing, simply. Eighth one is the communication, having good communication skills. Ninth one is dealing with fear. Okay, so these were the 9 things that are attached to our prefrontal cortex, prefrontal region of the brain. Activating this region might help us in decreasing our anxiety. It might help, okay, but at the same time we have to relax our amygdala portion also. So the people who say that focus over this part of the brain between the eyebrows, they are basically referring that we have to focus over the prefrontal cortex of the brain. Whatever part of the brain we focus upon, it grows, or interneuronal connections happen between them. Neurons never do decrease in size or increase in size, or decrease in number or increase in number. We have read that. So basically what happens is interneuronal connections increase in a particular part of brain that we focus upon. So shifting our focus of attention from the amygdala part to the prefrontal cortex region of the brain, it enhances our capability to think logically and take better decisions and life-saving decisions mainly. Okay, and this helps in reducing a lot of stress that we face in our day-to-day lives, and it happens gradually. Okay, so now we are coming to the last part of this video, that is the management of the stress. That's the most demanded portion. Okay, so let's learn how to manage stress in different possible ways, small ways. Okay, always remember this, only the small ways matter, not the big plans go and execute themselves, doesn't matter. Just the small things, okay, we have to implement. So first one is the getting away from instant gratification. For example, someone texted you, okay, someone uploaded a picture, whatever mess we do on social media. Okay, these things grab our focus. Okay, instantly replying to someone, instantly doing this thing, instantly doing all sorts of pleasure. These basically decrease our level of patience. In a longer term, it affects the level of patience that we have and induces stress in our body. Okay, this might lead to generalized anxiety disorder in a long-term basis. Second thing is having a proper diet. Okay, eat clean, salt, sugar, and things like alcohol, tea or coffee. Okay, these things. Just try yourself. Get away from these things. Coffee is one thing that we take in order to, decrease our stress level. No, that does not mean it's a drug basically. Okay, that's not what we take in our day-to-day lives. It just induces more of cortisol level in our body, induces stress. That's the matter is available online. Read it online. Now the third thing is moving our body. Okay, moving our body is very essential. Move it in any way. Don't make big plans like I'll have calorie deficit diet and have six-pack abs. No, just move your body. Try to move your body. The fourth thing is what we have all heard of, that is meditation. That is bringing our focus right here. It might lead to development of this area, that is prefrontal cortex, that we have talked about, that we have learned a lot of facts about. So this part needs to get developed in order to relieve our body from stress. Okay, there's no cure of stress. There's only ways to cope up with it, and these are some of the famous ways that we can do in our day-to-day life to cope up with it, with the stress. Okay, there are so many disorders attached to it. Generalized anxiety disorder, so many of them. Psychiatric issues, I've discussed those in my previous videos. So many personality disorders are also attached to it. So these are some ways that we should implement in our daily life, and we can definitely fight it. It's curable as well. Next thing we have all heard of is going beyond a comfort zone. So going beyond a comfort zone just requires like 1%, or you can say just 0.1% of our effort. Like just for example, doing one extra rep in the gym, doing one extra chapter, not hitting on the snooze button. That's going beyond the comfort zone. That might lead to development of the willpower. Willpower is basically a muscle. Okay, only some of it is used per day. Only some of it is developed per day. You cannot develop the whole willpower of all of your life in just a matter of. It's not just a matter of 1 week or 1 month. No, it develops slowly. Okay, going beyond the comfort zone. Next is reading new material. Okay, reading new material, introducing yourself to something new, or writing something new, indulging in something new. It might lead to decrease the level of stress. Last thing is the blue sky thinking that I have heard of recently. Blue sky thinking is a fancy word that is just used to attain a positive perspective. It says that imagine the best positive possible picture of something that you are indulged into. And there's always a saying that optimists live longer than pessimists. Okay, so that concept is known as blue sky thinking. So all of these 7-8 ways that I've told are related to the management of the stress, and they are just ways to cope up with stress. We cannot cure it, and we should not even cure it, because the level of stress follows a U-shaped curve. When we have got a particular maximum level of stress, we work at our best. After that, before that, we do not work. Okay, our body seems to lower our level of performances. So this was all about the stress. I hope you like it, and do suggest me what next topic I should make bit of content on, and let's learn the facts together.